initial step of a surgical hair restoration procedure involves the identification of the optimal area of the scalp for donor harvesting. Following the provision of local anesthesia, a thin section of the scalp is resected, followed by surgical closure utilizing plastic technique. Next, attention is focused forward into the receiving or recipient site area, which again following the application of local anesthesia, is followed by the transplant surgeon's creation of the recipient site openings into which the transplanted hair is located. This step in the procedure dictates both the directional angle of transplant hair growth as well as determining the density or concentration of hair within the transplanted area. Delegated to the physician, this is properly termed the design step of the procedure. The allied medical health staff executes the final step of the procedure, which locates the transplant grafts into the physician's created recipient site openings. This important step of the procedure requires a considerable degree of fine motor dexterity and careful attention visually to the recipient sites. Once completed, and following review of discharge instructions, the patient is ready for discharge in good condition and able to resume much of regular activities within a very brief period of time.